Hello, I'm Dr. Robert Brown with Elite Chiropractic and Rehab in Bloomington Normal, and I want to talk to you about why haven't you chosen chiropractic care yet? If you're watching this video right now, there's a good chance that maybe you're considering chiropractic care, but just haven't pulled the trigger yet. And I want to try to find out why, and I want to talk about some of the most common barriers that keep people from coming in, and so that I can address them and help put you at ease so that you can make an informed decision for your health. So I can tell you personally, I've had chiropractic care for many years, and I feel great, I feel vibrant, I always have a lot of energy, and I feel really good. And I can honestly attribute a lot of that to chiropractic care. I feel probably 1/2 to 2/3 of my age. I just feel very good all the time. And again, that's due to chiropractic care. So I want to talk about some of the main reasons why people don't come in. Like, sometimes people say, well, once you go, you have to keep going. And I'm here to tell you that that's not necessarily true. In fact, a lot of patients, they want to continue care once they've had chiropractic because they're feeling better and they're functioning a lot better. In fact, in our office we have 3 types of care. We have relief care where you can come in and just when you decide you want to stop care, you can do that. So some of our patients will come in, they'll get adjusted a handful of times, and then they'll just come back when the symptoms reoccur down the road. You certainly have the right to do that, with no obligation or commitment. The main type of care that we offer is corrective care. That's where you come in, and it is a longer plan. However, it's focused on correcting your problem so that it doesn't keep reoccurring. That's the most popular type of care in our office, and it's the one that I always recommend. Then finally we have maintenance care, which is also known as wellness care. And basically that's where you come in and get a tune-up once you've stabilized your condition. Now another barrier, people say, well, chiropractic's expensive. My response to that is, compared to what? Basically you cannot put a price tag on your health. In fact, the #1 cause of functional disability in people over age 50 is, you guessed it, spinal disorders. And once your spine deteriorates badly enough, there's really not a whole lot we can do to help you. So the key is to keep your spine from getting that bad in the first place. And how do you do that? With chiropractic adjustments. Chiropractic helps slow down the arthritis process. Especially with the rehab, we help to put those curves back in your spine, and we get you feeling a lot younger. There is a trend towards preventative care, and it all starts with chiropractic. Another barrier I hear is, well, I'm afraid it's going to hurt, or I'm afraid it might not be safe. And having done this for many years, I can tell you that's simply not the case. In fact, most chiropractic adjustments are completely painless. But the great thing is you feel wonderful afterwards. You typically feel much better afterwards. And chiropractic also is extremely safe. Let me ask you this. How much do you think a chiropractor pays for malpractice insurance per year? On average, most chiropractic physicians pay about $1,200 per year is all for malpractice insurance. You would think it'd be a lot more expensive, but it's not. That goes to show us that chiropractic is extremely safe because our malpractice insurance is a fraction of what any other type of doctor pays. Another barrier is, well, I know someone who had a bad experience at a chiropractor once. And in my line of work, as in any line of work, you have good and you have bad. Unfortunately, you're going to have some bad chiropractors. And then, fortunately though, you're going to have some very good ones. And my advice is that if you had a bad experience with one, don't hesitate to find another one. If you had a bad experience at a car shop and it didn't fix your car right, you would still have to take it to another car shop. So the same principle applies here. Just find one that treats you well and does a good job and stick with them. And finally, the last barrier that I want to talk about is, well, my medical doctor told me not to go to a chiropractor. And unfortunately, I have heard that a couple of times, although not too many times. Now, to talk about that, I just want to start off by saying that nobody knows as much about chiropractic as a doctor of chiropractic. Because guess what? A chiropractor is an expert in the field of chiropractic. You guessed it. So basically, a medical doctor that would make a statement like that, though, is just, they're most likely concerned about the adjustments because they don't fully understand how they work. They don't understand that they're safe, and they don't understand physiologically and biomechanically how it all works. So it's our responsibility as doctors of chiropractic to help educate the public as to how our treatments are helpful as well as safe. So what's keeping you from getting chiropractic care? You know, if there's something that's on your mind and you'd like to come in and talk about it, we always offer a free consultation. So just give our office a call at 309-663-9900, and I would love to sit down with you and talk about any concerns you might have. Thank you very much. I'm Dr. Brown.